Hi, this is Dr. Roy Steinbock from Mindful Pediatrics. I'm a board-certified pediatrician that's been integrating Western and holistic medicine for the last 15 years in my practice. Today on House Calls with Dr. Roy, quick tips from our house to yours, I'm going to be introducing our three-part flu series. In part number one, I'm going to talk about the difference between the common cold and the flu. I'll be discussing flu facts and how to understand them, and going over potential complications and who's at risk for those complications. In video number two, I'll be taking a deeper look at the flu vaccine and helping you understand if it's something that's appropriate for you and your children. And in video number three, I'll be discussing basic flu treatments and prevention from both a Western and holistic perspective. Okay, so let's get started. So what is the difference between the common cold and the flu? The common cold is caused by a variety of viruses, and we've all had it. We know the symptoms: runny nose, congestion, cough, maybe low-grade fever, low-grade gastrointestinal symptoms, but it typically goes away by itself within a few days and generally without any real complications. Now, in young children, we often can see that the symptoms will last longer and be a little bit more severe if it's the first time their immune system has seen that virus. The flu is caused by a real specific virus. It's caused by influenza. And typically there's multiple strains of that virus circulating at any given time. And the season for both the common cold and flu is really kind of fall, winter, spring. That's when we really see the highest rates, and they both really circulate at the same time. So typically the difference between the cold and the flu is that the flu is generally way more severe. We typically see a much larger variety of symptoms, so not only runny nose and cough, but also vomiting and diarrhea, sore muscles, achy joints, high fever. It typically lasts longer, the symptoms are worse, and in addition, we also see dramatically higher rates of complications, which I'll go into in a little bit. Let's talk a little bit about basic flu facts and what we know. So first of all, every winter it seems like the media goes crazy with the number of hospitalizations, giant outbreaks, and the number of deaths from the flu. On the other hand, I see lots of people telling me that, oh, the flu is really not a big deal, you know, it's just kind of like a slightly more severe cold. And there's some truth to that. The truth is that the large majority of people who are healthy and get the flu will be absolutely fine and you know, survive it without any significant complications. But let's look at the numbers for a second, because I think they're pretty interesting. The CDC estimates that somewhere between 5 and 20% of the US population gets the flu every year. They also estimate that up to 200,000 people a year get hospitalized for the flu, and somewhere up to 36,000 people die annually every single year from the flu. The World Health Organization says that up to 500,000 people die worldwide annually, and so those are pretty significant numbers if you ask me. The problem is that the statistics may not be all that accurate, and here's why. For starters, most people who are diagnosed with the flu never get a flu test. The diagnosis is really made clinically based on their symptoms, and as I mentioned, the symptoms of the common cold really look a lot alike. They can be very difficult to tell, and because both viruses seem to peak and circulate at the same time, it can be real difficult to tell between them. I'll give you a personal example. A few years ago, some of my family members had what I was positive was the flu. Just really the worst cold I've ever seen in my family. And so, being a pediatrician, I had the luxury to test them with the flu tests that we have at our office. And when I tested them the first time and they came back negative, I simply didn't believe it. I thought this has got to be, you know, false negative. Maybe I didn't do the test well. So a few days later, I repeated it, and it was negative again, which at that point I had to concede and admit that they didn't have the flu. So you can see even a trained clinician can have a hard time sometimes telling the difference between a really bad cold and the flu. The other difficulty in understanding the statistics is that the large majority of people that die from the flu don't die from influenza virus itself, but from secondary bacterial infections, and I'm going to go into that a little bit more right now. So the single number one most common complication that leads to hospitalization and death is pneumonia, and that's not caused by the flu virus, but caused by typically secondary bacterial infections. And who's really at risk for these complications? So the largest population at risk are the elderly. We know that they really comprise of the large majority of hospitalizations and deaths annually worldwide. I'd say probably the second largest risk factor would be having a chronic health condition, particularly cardiovascular or respiratory issues, things like heart disease or asthma, COPD, cystic fibrosis. Those people are going to be much more vulnerable to getting secondary infections and having complications from the flu. And then lastly, young children. So we know children under the age of 3 years old have a much higher hospitalization rate and unfortunately mortality rate as well. Though fortunately, that's a much smaller percentage than the elderly. So in this video, I really just wanted to lay down the groundwork for what the flu is and how to look out for its complication and who's at risk. In my next video, I'm going to take a much deeper look at the flu shot or flu vaccine. I always recommend individualizing care for my patients and family, and I'm going to give you the information you need to make an individualized decision for your family and children. If you like this video or would like to see future videos from us, you can follow us or like us on Facebook at Mindful Family Medicine, or you can get our newsletter at mindfulfamilymedicine.com.